Hello everyone. In this video, we will introduce you to the safety program for providing radiation treatments. Our program ensures that radiation therapy is delivered with pinpoint accuracy, and it includes many different components. Like your medical team, there is a team to ensure the safety of your radiation therapy treatment processes, as well as adherence to Health Canada and the Canadian Nuclear Safety Commission licensing and Accreditation Canada guidelines. In this video, we will introduce you to 6 of these components. Medical physicists prepare the treatment machines and CT simulators for clinical use by measuring and modeling how the radiation interacts with tissue in the body. This information forms the basis for our computerized radiation treatment planning system, where we simulate and plan customized patient treatments. Our team of medical physicists, physics associates, and radiation therapists test and monitor our radiation therapy equipment by performing daily, monthly, and annual tests to ensure we deliver the dose the radiation oncologist has prescribed safely and accurately. Measurements are often performed in water, where sophisticated equipment is used to measure doses within a fraction of a percent at positions accurate to a fraction of a millimeter. This allows us to ensure that we are directing the right radiation to the right place. Radiation therapists confirm laser accuracy every day to ensure patients start off each treatment in the planned position. X-ray images taken prior to or even during treatment allow for fine-tuned adjustments based on visualization of the targeted anatomy. These images are periodically reviewed by the radiation oncologist to confirm that treatment is proceeding as intended. Our safety program includes a team of specialized electronic technologists who are available for equipment corrective maintenance and emergency repairs. The team regularly schedules and performs preventative maintenance on our radiation therapy equipment. For example, many patients receive treatment on a linear accelerator. These linear accelerators, also known as LINACs, produce radiation by using high-energy radio frequency energy to accelerate electrons into a tube-like structure called an accelerating waveguide. These complex machines have a preventative maintenance plan for their mechanical components, radiation monitoring systems, and their pulsed high-voltage systems. We do careful surveillance and maintenance of our equipment and manage a parts inventory so our patients benefit from less unscheduled machine downtime. The Canadian Nuclear Safety Commission licenses and certifies our equipment and regularly comes to inspect our radiation safety program. The accreditation process identifies strengths and gaps in cancer care programs and processes, and one of the primary benefits is that it promotes a positive culture of quality and safety and encourages us to continually make improvements together. At Cancer Care Manitoba, the radiation oncology team works together to prioritize your safety. If you have any concerns regarding your safety during treatment, please speak to any team member about it. Thank you for watching this introductory to safety and radiation therapy video. For more information, check out our other videos in the Radiation Therapy Treatment video series.